Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi, I'm Dr. Lisa Hernandez, and I'd like to welcome you to Your Health television program on AMP Cable Channel Television 24 and on the web at ampmedia.org. I will be your host today, and my guests will be giving you valuable information that will help improve your health. Today, my guests and I will discuss the flu. Lately, there has been lots of media coverage about the flu. Reports state that this is the worst season in years. We know that each year, somewhere between 3,000 and about 50,000 people die of flu every year. How bad will things be this year? So what do we know about the flu? What's going on here in California and in Monterey County? What can we do to protect ourselves? What about the stomach flu? Is that related? Well, during this program, we'll hear from 3 local experts that will be providing you with everything you need to know to answer those questions. They will tell us about the flu, how to avoid it. They'll also be debunking some of the myths that we hear about the virus, as well as vaccines that are used to prevent influenza. These are the myths that sometimes I hear as health officer. So with that, I'd like to introduce my first guest. Kristy Michie is our first guest, and she is not an unfamiliar face to this program. She is a supervising public health epidemiologist for the Communicable Disease Unit of Monterey County Health Department. She's worked in that capacity for over 5 years. She actually started working when we had one of our other notable flu seasons that we handled, H1N1. She's a wealth of knowledge, and I'm happy that she's back today. So thank you. Welcome back, Kristy. And thanks for taking time to speak with us today.
Well, thank you for having me, especially to talk about this really important subject.
Well, I have the first question. Let's get on to the topic. I know everyone is hoping to hear the good, the bad, and the ugly about flu. So we've heard about the flu, but tell us about what causes it.
Well, flu is caused by a virus, and conveniently enough, the virus is called influenza, and it's actually a group of viruses. There are 3 types of influenza: influenza A, influenza B, and influenza C. Now, influenza A and B are the ones we hear about because those are the ones that cause most of the human disease and are responsible for the seasonal epidemics of influenza we hear about every year. Now, influenza A is divided up into different subgroups, and those are basically named or differentiated because of the proteins that are on the surface of the virus. So you may hear about influenza A, H1, H3, H5, and even within those there are different strains. So it goes out even further. So we talk about influenza A, H1N1, H2, or H3N2, and those strains vary between year to year. Now, influenza B is just influenza B. Now, this year in California and across the nation, we're seeing predominantly influenza A, H3N2. We do see some of the pandemic influenza strain that circulated in 2009 and also a little bit of influenza B. But flu season in California and in North America in general starts in about November and lasts through March every year. Some years it's a little earlier, some years a little later. This year we had an early season. Last year we had a late season. We saw flu well into May. This year we started seeing flu early, especially in other parts of the country. It's a little slower here in California. In some parts of the nation it's peaking, but right now we're still on the increase here in California and Monterey County in general.
Huh. Well, I just learned something about influenza C. We don't have to talk about it because I know that really what you said is A and B are the 2 strains that we look at, and those are the things that we'll talk about later in terms of those are the ones that we see in our vaccine. But Okay, good to know. So next question, you talked about the different types. What about the symptoms? How do you know if you have the flu?
Well, that's a good question. The symptoms are varied depending on what strain you get maybe and your own health in general. But one of the primary symptoms is fever or feeling feverish and chills. Most people get a cough, have a sore throat. We get that runny nose and congestion that makes us feel so miserable. Headaches, body aches, extreme fatigue, so feeling very tired. And some people, particularly children, may also develop vomiting or diarrhea with it. Now, if you have just vomiting or diarrhea and not the congestion and cough, that's something else, and I think one of your guests today might talk about that. We used to think about, well, how do you tell the difference between a cold and the flu?
Yes.
They would say, well, if you've got a fever, it's the flu, and if you don't, it's a cold. But that's a little bit misleading because some people don't get a fever with the flu. So not everybody with the flu has a fever. Really, the only way to tell whether you have a cold or a flu is to do testing specifically for influenza. Now, the reason some people don't develop a fever is because a fever is a natural response of your body to an infection. So it raises the temperature of your body. Some people have compromised immune systems, or like the elderly, and their body is not able to respond as well to pathogens as normal healthy people. So they don't get that response. So just remember, just because you don't have a fever doesn't mean you don't have the flu if you have all those other symptoms as well.
So you're already starting to debunk those myths, because I always thought, okay, well, if I have a fever, it's the flu. It's not a cold. So that's really good to know. Okay. So as I mentioned in the introduction, we've been hearing about the flu in the news. Why is it a big deal? Just in general, why should we be worried about influenza?
Well, I think there are two reasons for that. One is that flu can be a very serious disease. Not only do you deal with the symptoms that I just mentioned before, but sometimes you can have complications. You can have a sinus infection. You may have other kinds of infections. You may become dehydrated. Also, sometimes flu puts you at risk for what's called a secondary bacterial infection. So flu is caused by a virus, but you can pick up a bacterial infection on top of that and sometimes develop pneumonia. The primary bacteria that you might catch in addition to the influenza virus are things like Staphylococcus, Streptococcus, and Haemophilus, and they can cause really severe disease. In addition to that, flu can also cause a worsening of underlying medical conditions that you already have. So say you have asthma. When you get the flu, you might not only have to deal with the symptoms of flu, but also the exacerbation of your asthma on top of that. And I think the second reason really that we're hearing so much about flu this season is because flu is notoriously unpredictable. Some years we have a very mild illness, you don't hear much about it. Other years we have a more severe or more widespread illness. And this tends to be one of those years. We have what we call a moderately severe year this year. You mentioned that people die every year of the flu, and what determines how bad our flu season is really a whole host of things. One is this a strain of flu that circulated before recently? So people might have some partial immunity to it. Is there a vaccine for this strain? Is it part of the vaccine that we had this year? How many people got the vaccine, and did they get it early enough so the timing was before the flu started to circulate? And I know you're going to have another guest that's going to talk a lot about vaccines, so I won't talk about that. But I did talk about different strains and types before, and I wanted to explain a little bit more about that. What happens is that the flu is a very, I call it a smart virus. It likes to change over time and adapt. And that's kind of a process called genetic drift. So every year the flu changes just a little bit, it gets a little different. You may have some partial immunity to it. The next year it may change a little bit more, and slowly over time we lose our ability to fight off or our body doesn't recognize that it's the same strain of flu. So we can get the flu over and over because each year it's a slightly different strain. The other thing that can happen is instead of that slow process over time, we can have a sudden change in influenza, and that's called a genetic shift. So People aren't the only things that can get the flu. So things like aquatic birds, pigs, horses, marine mammals, dogs and cats can also get the flu as well. If, say, like an animal like a pig is exposed to some of the flu from, say, a waterfowl that they happen to be in the same area with and a human mixing, they can all get inside that pig and jumble up and mix together, and out comes a new strain of virus that nobody has any immunity to, or not very much immunity to. There's no vaccine for it. When that happens, a lot of people get sick, and we really have things like the pandemics, and that's what happened in 2009. We had genes from birds and pigs and humans all combined together in pigs, and out came a new strain that we had to combat. So in public health, we really have to be on guard about that.
Well, thank you, Kristy. One of the things I want to kind of re-emphasize is why should we care about the flu? I mean, the news media makes a big deal about it, but there's a reason for it, and one of the reasons is that the flu is unpredictable, one, in the way that it can affect a person individually. They can get complications where they could be dehydrated, they could get pneumonia, and then it can impact people who have medical problems already, whether it's asthma or some infection or illness that can cause them to have a less than better response to typical virus. And they can get secondary infections from bacteria. So that's really important. And then the other part is that flu is a smart virus. And that's what we saw. That's what we see. And that's why we always have to pay attention. So I want to move on to the next question about, even though we know that the flu is smart, can we be smarter?
Yes, we can. There are things that we can do every year, every day to protect ourselves about the flu. And the first and most important is to get your flu vaccine every year. Everybody over the age of 6 months should get a flu vaccine. And I'm not going to talk about that because you have an expert in influenza vaccine who's going to come and talk about that.
But yeah, it's good to hear. We want to hear it over and over. Get your flu shot.
That's right. So you'll get to hear more about that. The second thing you can do that's really important is to wash your hands. Wash your hands thoroughly with soap and water, and frequently. The flu is actually spread by little droplets that come out in respiratory secretions in people who have the flu. So when you cough or sneeze or even breathe, there are these little droplets that are suspended in the air, and they can land on surfaces, on people. And when you get those droplets that are then brought into your mouth or nose or eyes, then the flu is passed to you. One of the things that we were taught when we were growing up is cover your cough. So when people cough, they put their hands up to their face and they coughed. Well, what happens is those droplets then are on your hands, and then you go to see, hi Dr. Hernandez, and you reach out your hand and shake it, and then you've got the flu germs on your hand. You go back to your office and you are eating a nice healthy apple and you didn't wash your hands, and so now you're ingesting those flu germs, and that can make you sick. So washing your hands is so important. And if you don't have access to a soap and water, hand sanitizers that are alcohol-based are a good substitute. But really the best thing to do is to wash those hands frequently with soap and water. The next thing we can do is increase social distancing, and that's just a fancy way of saying stay back a little bit from people. If your normal way of greeting people is to give them a hug and a kiss when you see them, well, you might want to stand back a little bit and exchange a friendly smile and a wave instead. Really, and if you see somebody who's visibly sick, who happen to be in the grocery store and somebody's coughing and sneezing, try to stay back about 6 feet from that person, and that will really help to keep the flu virus from spreading.
So we'll know who's watched this program by seeing if someone's walking around with a tape measure in the grocery store after the cougher.
Right. And the last thing that you can do is really make sure you stay healthy. So eat healthful foods, get exercise regularly, get plenty of rest, try to do things that reduce your stress, because we all know that a healthy body it goes a long way towards keeping us from getting sick and having these kinds of infections.
Okay, so I want to go over those things about how to prevent getting the flu. Actually, I would say these are good things to prevent any infection. So one, except for the first one, which is vaccine, which is specific for this case, flu vaccine. So get the flu shot, get the vaccine. It's still available. You didn't say that, but I know our next guest will say that as well. Number two, if you're sick, cover your cough. I think you said something before that, but let's just go with that. Cover your cough, and do it where you're not using your hands to cover your mouth. Use what I would tell my kids to use, the Count Dracula type of cough. So cover your cough, not using your hands. Wash your hands. Whether you're coughing or not, it's a good piece of advice. Soap and water, if not, using the alcohol-based hand sanitizers. Eat healthy and get enough sleep. Did I miss anything?
No, I think that covers it.
So I think that's really great advice, so that's really important. So what about if you've done all those things, you've gotten the flu shot, and you still get sick? What happens if you have the flu? What should you do?
Well, the first thing you should do is don't feel bad. You're not alone. About as many as 5% to 20% of the population every year get the flu, so about 1 in 5 people. So for most people, the treatment of flu is supportive. So that means we don't really try to kill the virus itself, we just try to treat the symptoms. So you can take over-the-counter medications to reduce your fever, medications like cough syrup or decongestant, and always follow the directions on the package, of course. And always, make sure you drink lots of fluids, doesn't have caffeine in it, get rest. Importantly, stay home if you're sick. You should stay home until you don't have symptoms, at least 24 hours. It's very easy to spread the flu, and we don't want to go out and make other people sick. People are infectious with the flu from 1 day before they start showing symptoms, before they even know they're sick, to at least 5 days after they started having symptoms. And children can shed the virus, be infectious for much longer. I always laugh and say children don't like to share anything but germs. So make sure, don't wait until the flu season is here. Before flu season in October, have a plan for what you're going to do when your child becomes sick. If you don't have sick time, how are you going to be able to take off work and still be able to pay for your groceries and make your bills? So get those plans in place. And make sure that if you do have some underlying medical conditions, if you're pregnant or if you're elderly and you become sick, talk to your medical provider. They actually may prescribe something called an antiviral medication that actually does combat the flu virus itself. It's not an antibiotic. Antibiotics are not effective against the flu, so they wouldn't work against the flu. But for those people who may be at risk for serious disease, your physician may have a medication that he would want you to take, or she. I guess I shouldn't.
Yeah,
Just
she sounds good.
Yeah, limit medical providers to males.
Well, it's interesting to hear. So the first thing isn't to go to your doctor's office or go to the emergency room.
No, most healthy people can get over it by staying at home and taking some over-the-counter medications and resting.
But if you do have concerns, or if you do have medical concerns, plan ahead. So we only have a few seconds, but I do want you to talk a little bit about what the health department is doing to combat the flu.
Well, it's really sort of a three-phased approach to it. The first thing we do is we have to monitor. It's very important to know what's happening. We talked about all these different types of flus and kinds of flus, and we need to know what's going on. So we work with our medical providers and our laboratories in the communities. It's really a great partnership. They provide information to us about how many people are coming and being seen for flu, and we get specimens from them, and our public health lab is just exceptional. And they do these really advanced tests to be able to tell us what types of flus are circulating. So it's a great partnership. And then we pass that information back on to the provider so they can better treat and diagnose their patient. The second thing we do is we help control outbreaks. So
what's an outbreak?
Outbreak is when we have a bunch of people who get sick all at once from the same disease. Sometimes it's from, you think of it with foods, you hear about the outbreaks of salmonella and things, but with flu, it tends to pass from person to person. It happens in schools and daycare centers and long-term care facilities that care for our elderly. So we go in, we have what I call a little strike team, and one of your guests today is part of that, where we go into the facilities and we provide them information about how to control the spread of influenza, take samples and tests. So that's an important thing we do. And lastly, we encourage vaccination among all Monterey County residents, and we help promote that for people at high risk, people who don't have insurance or maybe underinsured and can't afford to get a vaccine. And that really is as well a community partnership. And it's a great way for us to work together with our communities. And I know that flu isn't something that we can just think about at one time in the year. We have to really plan and monitor and do outreach all year long.
Well, thank you, Kristy. Well, it's the end of this segment, and I want to thank you, Kristy, for coming. As usual, she is an expert in all things communicable. I can't even say the word communicable. We talked about flu. We learned a lot about flu. I even learned about influenza C and how to remember to stay home when I'm sick. We're going to take a short break. I'm Dr. Lisa Hernandez, your host today. We'll be back in 2 minutes. Thank you.